Global Window laga viewers kan sobke swagat kuri ase. Aje ami khan bishi important topic ekta logine ai ase mental health laga opore. Mental health is very important at every stage of our life. Bacha pra suru kurine adolescence noholi be ami khan adulthood noholi be ami khan bura buri nohotok mental health to bishi important ekta ase. Aji mohan lagore Dr. VARECHON MAKANG MBBS MD consultant psychiatrist neuropsychiatrist de-addiction medical yede well-being clinic te hegine ase tagi be lop mental health laga opore lop discuss kurbo aro etu laga issue opore kinega kurile bhal hobo goine lop huda hudi kuri sabo. Thank you so much, Dr. VARECHON MAKANG, for giving your time to Global Window. Aji ami khan viewers khan ge lop educate pi kurubo aro mental health laga opore lop discuss kurubole apni laga time de homoy de gane bishi khushi pai ase.
Okay, thanks for having me here.
Okay, so mental health to ki ase? How important is mental health awareness in the community?
Before we come to the mental health, when we say a human body, there is a part, physical part and a mental part. So both of them cannot exist independently. They are interlinked. So if you, even in the computer, you cannot separate software and hardware. Just the same like that only. So they has to be coexist properly. So as even to the WHO definition of health, it is not only physical, not only psychological, but it's a complete state of physical, mental and social well-being only, without any disease or enmity. So our physical part and mental part has to be coexist properly. Moreover, our environment, yes, environment also we have to coexist coherently. Yes, and why it is important in the society to have a awareness of mental health is that usually people accepted the physical ailments or any kind of disease. Okay, like any kind of hypertension, diabetic or some kind of malaria, asthma, something like that, they accept and people treat properly. But when it comes to a mental illness, any kind of minor or serious, people take it otherwise. They give a negative impact. Some kind of discrimination is there to the one who is suffering that disorder. That is mentally, they take it like the one who suffer some kind of mental illness. They think that he or she is having some weak personality, weak emotion, some kind of morality may be not good. That kind of impression is there. But as the physical have ailments, the mental also, the same thing is there. Even the causes, the etiology also is multifactorial. In the physical side also, same as psychological side also. The percentile may be a little bit differ according to the disease to disease, but the cause or the illness, same like physical and mental side also.
So how can we know that someone has mental illness, and where and when do we seek help?
Actually, when we come to a disorder, it's very difficult to demarcate this one. But for example, like someone is a sleeping problem for 1 night, 2 night, that's okay. Even the appetite, like you feel like eating for 1-2 days, that's good. But the severity and the duration is important. And in the morning you wake up and your mood is low, or you feel so hopeless, you feel so down. For 1-2 days, that's a normal kind of misadjustment. But If it prolong for a long duration of time, at least minimum of 2 weeks of time, if you feel very sad, you cannot eat, you cannot sleep for at least 2 weeks, then something is wrong with you. So those things, it's good to consult doctor also. Yes.
So ami khan itia Nagaland laga ase gule do, what are the common mental illness in Nagaland?
In Nagaland, yes, it's not according to the census, but according to daily practices. The number one we come across the cases is the anxiety group of disorders. No, that is the most prevalent in Nagaland. Mainly general anxiety group, obsessive compulsive disorder group, and some kind of panic disorder group is the highest number of patients we get. Number two will be the depression group. Yes, depression also is highly prevalent in Nagaland. And number three, I should say, like a drug abuse, drug dependence in Nagaland. No, when we say drug dependence, if we compare with the national average, Nagaland is high prevalence in terms of cannabis, opiates, dependence, or even alcohol. Alcohol rate in Nagaland, actually 36% people consume alcohol as compared to the 22-23% of Indian average of alcohol consumption. No? And even the opiates consumption also is very high. Opiates consumption, actually Nagaland will come around 6.5% of Nagaland population consume opiates. And in all India ratio, if you see, the average national ratio is around 2.8, like that only. So all these things, even the sedations like medicine, there is a high consumption in Nagaland. Because 9.8, they said in 2019 census, they said people are dependent with the sedative. But national average is only 1.1 only. So these things has to be curbed in a proper way. Yes.
Okay, so how prevalent is drug addiction in Nagaland? Aro ami khan iniga drug addiction thagi ase gule do, kote ba jai kine treatment lowo lage?
The main problem here in Nagaland is that drug dependence rate is much higher than the Indian average. So it's a concern for the state also. Mentally, yes, if you compare with other states, our Nagaland states have less detox center or a proper psychiatric nursing home. But the main thing we can do detox is that it depends on that person concerned, the patient. If the motivation is good by himself, if he is willing, if he is a strong willpower, then even in the small setup, home detox also can be done. Yes, most of the patient we have treated, we do mostly of home detox also. So if the patient is well motivated, yes, if it is well motivated, then even home detox is very effective. Yes.
What are the early signs of mental health issue in children?
In children, actually, the signs symptoms little bit differ from the adult. Usually, even in depression or anxiety, the more common symptoms is the children get a little bit agitated. Yes, and especially in the school performance also. Yeah, slowly the performance become regression, is slow down only, and even the nighttime, like their sleep, their appetite, it will be affected. Yes.
What are the early signs of autism in the children?
Disorder indicates autism. The disorder is more of autistic. It is a neurodevelopmental disorder. Actually, the sensory perception, there is a disorder in the neuroperception. And the main problem here is their communication skill, the language and social interaction is not good, and also like their motor activities, means their behavior, the body becomes stiffness or some kind of repetitive movement. All those things will be seen. At least it start from 1.5 years to at least 6 to 7 years of age.
Okay. Then what therapies or interventions are most effective?
Actually, for the autistic children, the main thing is the behavioral therapy, but it depends on the stages of autism also. Make it into stage 1, stage 2, stage 3, or level 1 to 3. So, if it is just level 1, then some kind of behavioral therapy is okay. But if it is go to level 2, then some kind of substantial behavioral therapy is important. And if it is a stage 3, then very substantial behavioral therapy. We call it like learnable, trainable, or some kind of dependency to the level 1, 2, 3, like that.
Okay. Alcohol aro drugs manu laga mental health te kinika affect kure?
Actually, yeah, any kind of ami khan motu khai lebi, drugs khai lebi, after long duration of time, you are hooked to that substance, and the substance also like in the body, they are used to in the receptor. We call it a receptor. So in the long run, almost all the organs it will be affected. For example, we just say the alcohol. Yes, if it goes to the stomach, and it will affect the liver also, even the kidney, even a nerve. Okay, in the long run, actually, there is absorption difficulty of some vitamins in the brain. So in long run, because of deficiency of the vitamin, you will have some kind of mental problem. Even secondary anxiety, secondary depression, or even you can have some kind of a seizure. We call it RUM fit. Yes, generalized tonic-clonic seizure. And even in long run, if you don't quit and if it go, then sometimes you can see some imaginary images also. We call it a visual hallucination. That kind of stage will go. But if you don't stop it, then very late stage, even your memory will be completely like forgetfulness, those things will be there. We call it a Korsakoff psychosis. But even in liver also have stages. Like you'll have fatty liver, then alcoholic hepatitis. First it will be fat deposit and enlarge, and if you keep on drinking the alcohol, then liver will start enlarge. And if you continue for a prolonged time without stopping, without quitting, then liver will at last shrink. It will just die off. So at that time, even our it's just like a cancer of liver only. Yes, if you stop the alcohol also, it cannot reverse it. So almost all, and if the liver is becomes so damaged, then even it will go to the brain also. We call it hepatic encephalopathy. So all these things, like even the drugs during the withdrawal time, and even during the dependency time, they'll have so much of psychological problem. Yes, only during the period of ingestion of the alcohol, they'll have, we call it trip. No, only that time they'll having euphoric, they'll be well maintained, but after the loss of the drugs action, they'll have withdrawal symptoms, psychological problem, they'll have agitation and so on.
So sir, ki laga treatment available ase for the people dealing with both substance abuse and mental health problems?
No, it's depend on the cases to cases only. For drug dependence, yes, that also it depends on the place of treatment. If it is in our setup like private clinics and all, then we properly assist the patient. We give whatever it is necessary. Medication will be prescribed. We'll just give little bit of supportive psychotherapy to the patient. But otherwise, those who are very chronic and those who have a less motivation, they need to go to the rehabilitation center also, so that proper detox treatment can be taken there. And some other kind of mental disorders, any kind of mental illness, they can bring to the clinics only. So yes, mostly that kind of mental illness only with medication also it can be done and follow up time to time. Yes.
So last question ekta ase apni ki advice dibole mun jai viewers khan ge nohile bi kunba silently ekla lukai gine struggle kuri ase addiction nohile bi mental health issue lagao pore
Ami khan any kind of problem thakile bi very openly iniga consult koril to bhal ase. If you compare western countries, so India ami khan laga Nagaland khan India khan de differences to ki ase. In western countries, though, actually they are aware of the mental health. That's why key problem hoile bi chotu time te the earlier the better only. Any kind of mental disorder or any kind of a problem. So if you have any problem, like if you cannot sleep for long duration of time, if you are stressful for a long duration of time, if you are not happy, if you are seeing some imaginary images or something unusual for quite some time, and daily like basic needs, if you cannot sleep, if you cannot eat, if you cannot go to your office because of some problem, then jaldi saile to bhal ase bhal bra jaldi bra treatment korile jaldi bra bhi thik hoi jai ete bra apni ki drugs khaile bi ye to अपनी डिटॉक्स न करेगी ना इनका जाइले तो फ्यूचर दा अपनी लगा लाइफ अपनी लगा फैमिली अपनी लगा स्पिरिचुअल एस्पेक्ट भी की होइले भी सब इफेक्ट होबो ये तो बड़ा तो ओपन अप करेगी ना प्रॉपर फैमिली खान भी कन्विंस करेगी ना प्रॉपर इनका होम डिटॉक्स करबले भी पारे ये तो बड़ा इट्स नॉट ओनली लाइक रिहैब सेंटर दा जाबो इनका हॉस्पिटल एडमिशन इनका न करिले भी अपनी लगा विल पावर अपनी लगा मोटिवेशन तो बाल होइले घोरते होइले भी आमी खान होम डिटॉक्स तो अल्कोहलिक्स होइले भी ड्रग्स होइले भी एनी काइंड ऑफ प्रॉब्लम तो आमी खान इनका आउट पेशेंट बेसिस ते भी करिबले पारे ये
बिशी थैंक्स अपनी बात लगा टाइम दिगिने आमे हन व्यूअर्स खान गे मेंटल हेल्थ लगा परे भाल बरा एजुकेट कुरिसे मन गे भाल बरा समझाई दिसे इतु गाने अपनी गे ग्लोबल विंडो लगा टीम लगा थ्रू बरा थैंक यू सो मच
ओके मोस्ट वेलकम यस
तो व्यूअर्स अपने खान भी हुनी पाइसे दे डॉक्टर ब्रा में हन के बाल ब्रा बुझाई दिसे और ताई ब्रा कोए से कि 2019 लगा सर्वे रे दो अल्कोहल कंजम्पशन दो इंडिया दो 22% है ऐसे उसे whereas in Nagaland 36% আছে তো নাগাল্যান্ড তো বেশি মানুহ মুদু খা লাগা তো কনজাম্পশন তো বেশি হাই রেট তে হই গিনে আছে আর ন্যাশনাল লেভেল তে আমি খান চাইছে হলিবি ড্রাগস খান খা দুবি নাগাল্যান্ডে হাই আছে কইনে জানাই দি আছে মেন্টাল হেলথ তো একটা ফিজিক্যাল হেলথ আছে আর এটু দুইটা তো একই লগতে ইন্টারলিংক হব লাগে এন্ড দে শুড গো হ্যান্ড ইন হ্যান্ড এতে ডক্টর বাবে আমি হানকে জানাই দিছি কি অটিজম তো একটা নিউরো ডেভেলপমেন্ট ডিসঅর্ডার আছে কইনে বি জানাই দি আছে আপনি লাগা বাচ্চা খান নিউরো ডিসঅর্ডার থাকিছে বলি তো কমিউনিকেশন স্কিল দিবি স্লো হব ল্যাঙ্গুয়েজ দিবি আমি খান মানুহ কি কথা কৈছে দিবি ফলো কল না পারবো আর আমি খান সোশ্যাল ইন্টারেকশন দিবি করবলে না পারবো কইনে বি জানাই দি আছে আর এটুটো ভাল নাই এটু গানে আপনান কি বি জানাই দি আছে কি ইনিগা লাগা প্রবলেম থাকিছে বলি তো লুকাই কিনে আমি খান মেন্টাল হেলথ নহলে বি অ্যালকোহলিক তে আমি খান প্রবলেম থাকি কিনে নিজর লুকাই কিনে ঘরে বুই আছে বলি তো ইনিগা না থাকি কিনে আপনি খান ডক্টর লাগা হেল্প লবি ডক্টর লগরে যাই কিনে লইছিল দ্য আর্লি এজ কিমান জলদি কৰে ইমান জলদি ভাল হ'ব আমি খান ওয়েস্টার্ন কান্ট্রিজ খান দিবি চাইছি বুলি তো আমি খান এটু লাগা ডিফারেন্স বেশি দেখি আছে আমি খান ইতি ভালে আমি খান লাগা স্টেটে আছে বুলি সরম আছে কোনে সোশ্যাল স্টিগমা থাকি কিনে নহলিবি একটা বই থাকি কিনে নিজর হে গড়ে দুখ থাকি কিনে বইহে হলিবি ইনিকা নহই কিনে আমি খান ওপেন থাকিব লাগে আৰু আমি খান ডক্টর খান লাগা মদত লাগি আছে কলিবি তাতে যাই কিনে মদত লৈছি বুলি আমি খান ভালবি হ'ব আৰু আমি খান লাগা উইল পাৱাৰ বি স্ট্রং হ'ব লাগে কই নিবি জানাই দিছে আৰু তাহান লাগা ইতে ক্লিনিক তে ল্যাব পি আছে কই কিনে আছে আৰু আপনি খান যদি কিবা প্রবলেম ফেস করে আছে বুলি তো ডক্টর VARECHON MAKANG তাই MBBS আছে তাই তো কনসালটেন্ট সাইকিয়াট্রিস্ট আছে আৰু নিউরো সাইকিয়াট্রিস্ট আছে আৰু তাই ডি এডিকশন মেডিসিন বি তো লাগা পড়িবে তাই ট্রিটমেন্ট দে তো ওয়েলস্প্রিং ক্লিনিক JM কমপ্লেক্স নিয়ার চেকিয়ে গেট 3rd মাইল Tarokopattor. So itia kane man ase. For more news and update, keep watching Global Window. This is your reporter Yaungomla with my camera person Anum reporting from Wellspring Clinic, Tarokopattor, Dimapur.